Welcome everybody, I hope you can hear me okay. I'm very pleased to welcome you to the second event in our public lecture series on Big Data, Big Questions, which is organised as part of the activities of the Economic and Social Research Council's Business and Local Government Data Research Centre, which is a partnership between the Universities of Essex, Kent and East Anglia. My name's Ruth Hancock. I'm a professor in the economics of health and welfare here in the Norwich Medical School. And today I am very pleased to be able to welcome Tom Baker from BT Global Services to talk to us. He's going to talk about title may have changed. Data and the future city, ecosystems, marketplaces and sustainability. I think very similar to what we advertised. Tom is lead for strategy and engagement in relation to smart and healthier cities at BT Global Services. He was previously Chief Information Officer at Norfolk County Council, so welcome back to Norfolk and Norwich. It's very nice to see you here again. There he was responsible for conceptualising and implementing digital Norfolk ambitions, or DNA, so he's good at acronyms, and which was Norfolk County Council's project, it is Norfolk County Council's project to make better use of information and data to improve public services in Norfolk. As well as being good at acronyms, it says on Tom's LinkedIn page that he is innovative and tenacious. So I'm very much looking forward to hearing him talking to us today. So welcome, Tom. Thank you very much.
Thank you, Ruth. Well, yes, it's great to be back in Norfolk. So I spent 2 happy years here, very interesting, and I spent those 2 years in a B&B, so I didn't live here, I commuted. And before coming here, I popped into the B&B and was reunited with effectively my surrogate parents who had looked after me in sickness and in health whilst I've been here. So it's got a fond spot, I guess, in my heart. And Norwich. And when I arrived, what sort of really struck me about the place was the opportunity. The opportunity that's here, its proximity to London, the opportunity, the quality of life afforded by the city. So it's great to be back. And it's great to be back here at the Business and Local Government Data Research Centre. So firstly, I'm curious to know who's coming along to a lecture like this. So it'd be great for my understanding if you could put your hands up when I ask these questions. So how many academics and students have we got in the room? There we are. Do we have anybody from local government? Where are you from? We can exchange some notes. What are you going to be doing? Wow. Things are moving forwards. That's progress. Because I don't see a lot of councils out there recruiting business intelligence folk. And if you think about some of the challenges that face the UK at this point in time, maybe there's a lesson there to be learned. How many people are here from business? 2 people, three. There we are, don't be shy. And the rest are impartial observers, I guess. And that really tells me something before we get stuck into the lecture about how big data is perceived in local government. And this is part of the issue, this is part of the challenge, and you're going to have your work cut out at Norfolk. Despite the fact there's some really good people there is a challenge, really, of enabling people to really understand the power of information, of data, of the right quality data, of what it can mean when it's linked together to drive actionable insight and intelligence. And yeah, I've been reading the press, doing a bit of looking at what's happening with the County Council in particular here, given my background. 25% cuts, I think, over the next 3 years. That's phenomenal for an organisation that's already taken 30% of its cost base out. We've got to ask ourselves some pretty fundamental questions, I think, about the sustainability of public services. So I'm going to talk about that. I'm going to do some scene setting. I'm going to talk about devolution. So I work in a team in BT that looks at how we position ourselves, our strategy around UK cities, around devolution in the UK, national, local devolution, how we adapt as an organisation in respect to those challenges. On one hand, you've got devolved areas talking about setting spatial strategy. setting infrastructure strategy, and for us that means broadband, superfast, 4G, 5G. You'll have seen in the news that BT has just been successful on its journey to acquiring EE. So these are big things for us as a company, but they're also big things for regions as well. And we're going to see quite a paradigm shift, I think, with respect to how public services are structured. But what I also want to say, and I don't want to put you off here, is that it's really, really difficult in local government at this point in time. It's really, really difficult to enact change. There is a huge amount of change that needs to be pushed through with regards to local public services, and executing on that in the current environment is very, very difficult. So against that backdrop, we'll start. 750 statutory services. Yeah, it's phenomenal, isn't it? People would say to me, you know, is it interesting working in the public sector? Well, you know, the public sector is not about making widgets. It's not about a defined business model or set of processes. There are numerous ways to achieve your objectives. There might be numerous different objectives, and of course there's a political element to all of this as well. So there is no more challenging environment for a budding data scientist than local government, smart cities, the future of the UK. So let's consider that as we wander through the presentation. So we've touched on some of this stuff. The team I work in is headed by a guy called Mike Blackburn, and Mike chairs the LEP, the Local Economic Partnership, over in Greater Manchester. It's the most dynamic LEP in the country. He tells me it's the quickest growing, all of these things. Which is all very interesting, Mike, I say. Yeah, well done. But the point is that he's had a ringside seat, really, of what's happening in Manchester regarding devolution. So devolving powers from our really sort of centralised way of doing things at this point in time to the regions is something that we're going to see. And there's a rationale for doing that. We've got to do more. We understand some of the pressures, I think. You probably all understand. You've all read the papers. You all watch the news. There are huge pressures in terms of society at this point in time. There's an ageing population. There's more of a requirement for public services. At the same time, we're cutting those services. We need to improve the efficiency of what we do. That's quite clear and that's quite obvious. We need to think about the models which we use to deliver public services, how we're structuring those things, the role of social care and the NHS, their integration potentially. We need to do some serious thinking about that. So there's some big challenges there. There's big challenges in relation to the population as well. That's growing quite significantly, and the proportion of people who are aging is again increasing. So let's look at devolution, I guess, in a bit more detail. Things are challenging. Things are already complex, 750 statutory services. But if we take the example of Manchester, we need to look at that, because in Manchester, they're devolving health and social care budgets to be managed at a local level. We think in BT that devolution is going to be the single most disruptive change to the way our cities are run and governed, possibly since the Industrial Revolution. It's very clear that there's a lot of politics involved in the whole devolution agenda. It's almost the personal pet project, I guess, of the Chancellor. And I'm sure later on over drinks we can maybe discuss some of the politics of this, but only at a sort of very high level. We don't want to get too embroiled in these things. But yeah, this is definitely the direction of travel for at least the next 4 and a bit years, and potentially the next 5 years after that. I was at a conference recently where Greg Clark was speaking. Greg Clark is the DCLG Communities Local Government Minister. And he said that he envisaged in a couple of years' time that the totality of England would be covered by devolved local authorities. We see it in the press. I don't know if you follow these things, maybe it's just me, but the North East are signing a devolution agreement. Greater Manchester has signed a devolution agreement. Even Cornwall, bless them, have signed a devolution agreement. I think there might even be an aspiration here in Norfolk, possibly to cuddle up to Suffolk and to sign a devolution agreement here. What does that mean? Well, it means the devolvement of more powers, more responsibility from Whitehall to the regions. So we estimate that around 15% of government expenditure at this point in time is effectively made by local authorities. And we think that figure is going to rise to closer to 40%. That's a big shift, isn't it? That's a big shift of power base. And not only that, we think that local devolved regions and areas are going to be responsible much more for shaping a lot of what is done by central departments at this point in time. There will be far more say in local government, devolved regions, with respect to the management and the expenditure made by departments such as DWP. So putting it very simply, there's going to be a mass migration of budget and investment from a central location to the regions. And there's a clear rationale for that. The thinking goes that decision-making can be much more effectively carried out in local regions. So there's an aspiration for local areas to play much more of a role in terms of public sector reform, but there's also at the heart of this quite a significant aspiration to link the reform of the public sector to our productivity rates in the UK. And some of you, again, may have seen this recently. I think the figure that often gets quoted is that we're 30% less productive than the Germans, even the ones knocking out Volkswagen cars, probably. If they didn't cut so many corners, there wouldn't be in this problem. So there's a huge challenge there, huge challenge for the UK. And working across cities in the UK, we get to understand a bit about what drives them. And it's fair to say that most cities up in the north of England are carrying quite significant deficits. I guess that's fairly obvious, but these are really very sizable. So Manchester, as a region, Greater Manchester, 2.7 million people, has a deficit, a significant deficit, a couple of £1 billion a year. Now, obviously, part of the devolution agreement is designed to try and address that situation. So, definitely, we think that moving more powers from Westminster to the nations has moved up the political agenda, certainly after the Scottish independence referendum. In particular, there's a growing recognition that cities matter to the future and the shape of the national economy, and we're seeing that through the articulation of the Midlands Engine and the Northern Powerhouse. And there's also, I think, a realisation that any future reductions in public sector expenditure as part of any deficit reduction strategy will be impossible to deliver without changing the way that we deliver public services. And this requires significantly more to be done at a local level. So you're joining the council at exactly the right time. You're going to be shaping Reimagining Norfolk, is that what they say? I think so. You'll be helping reimagine Norfolk. I quite like it the way it is, to be honest. It's quite relaxing. It's good quality of life. You can go to the beach. The city's nice and all the rest of it. So it's really, really interesting, I think, and we're at a sort of paradigm shift, really, with regards to what's happening. What I think is also interesting, given that we're here today talking about the local government and business data centre, is the fact that business is going to potentially play significantly more of a role in the shaping of place than it does at this point in time. So if we think about the skills agenda, clearly there's an aspiration with the current political administration that business is right at the heart of that, shaping decisions to be made and looking at the future needs for any workforce going further forwards. I think it's also apparent that we're going to be looking at different business models in relation to the delivery of public services at this point in time. I had the opportunity to visit the National Ageing Science and Innovation Centre in Newcastle a couple of weeks ago. I thought, Struth, this is going to be interesting, do you know what I mean? But it was very interesting. And one of the stats that they trotted out to me was that 80% of the wealth in the UK is held by the over 50s. Well, I guess it stands to reason to a certain extent, but if we're looking at pressures driven by an elderly population, we've got a health system that potentially can't cope with that. Someone's going to have to pay somewhere along the line. And, you know, these are the sort of big, difficult questions that I could never really sort of stand here when I was working for the council and articulate, because obviously there's a political dynamic. But these will need to be addressed, we think, moving further forward. So you can see here on the slide that devolution is marching away. We're going from lots of different local authorities at this point in time, some 1,400 different delivery agencies within the public sector, excluding GP surgeries, universities and schools. And we're starting to see those things coalesce. And we think they're going to coalesce to roughly 35 devolved regions. That's what we think, having done the maths. And that's going to be really very, very interesting, because we think those new regions are going to start to behave in very different ways, and they're going to need data and information potentially to do that. So, talked about the, got a logo missing there. I talked about the centre up in Newcastle, and that's really interesting. That's a £40 million investment. £20 million is coming from central government. £20 million is coming from a range of stakeholders in Newcastle. And it's interesting because it's symptomatic of a trend, we think. People are making these anchor investments at this point in time. And BT are part of two of those. People are thinking about the sort of capabilities that they need to innovate, to drive sustainability, to think about doing things differently. So we see the academic health networks across the UK. We see the Ageing Science Centre up in Newcastle. We see an initiative called MK Smart, which I'll talk about, which is very much focusing on IoT. I'll talk about IoT, the Internet of Things, data, information, sensors, the flow of that data across cities and how that can be harnessed, and how we are actually harnessing that to drive new innovations, new business models, and how we're helping grow the economy in Milton Keynes. Really very fascinating. We won an award, the TM Forum. It's a big deal in the tech industry. It was a big deal for some of my colleagues who got to go to Nice. Not me, unfortunately. We won an award for enabling a city digital ecosystem. Can you imagine there's such a thing as an award for that? Well, it's sort of kind of interesting, isn't it? It's a bit spurious. But BT, little old BT, won it up against some of the big American tech giants. We won it for the work that we're doing in Milton Keynes. So Milton Keynes is very much focused on built infrastructure, and we'll talk about that, as I say. We're also doing some work with Bradford. And there is an enterprise zone there. We all know what enterprise zones are, and that enterprise zone is purely focused on digital health, which is fascinating, isn't it? Would you have thought there was enough businesses there interested in digital health to build an entire enterprise zone? Well, yeah, apparently there is. And we're involved in that. And that's really interesting from a BT perspective. And this is where BT, I think, is an interesting organisation and needs to play a role in the future of public services. If we are developing connected health solutions, if we're helping people manage their long-term condition, or if we're helping people remain independent longer, then actually that's using our networks. So there's a very interesting sort of commercial model and rationale for us to be investing in some of those things. So we're seeing more and more of this happen, and I think it's a bit of a challenge really to get more people from local government along to the next session. And it's also a bit of a challenge to really understand how this sort of initiative at UEA can actually benefit Norfolk, because it's got huge challenges. And this is what we think will occur more and more, is that universities, colleges, local authorities, hospitals, there'll be the blurring of the edges there, and there'll need to be sharing of capability, and there'll need to be an understanding of where strengths lie. So it's a really interesting time, I guess. So I'm going to talk a bit about BT, what we're doing with Bradford, what we're doing with Milton Keynes, and what we're doing across the country. I'm going to talk about information, data standards, how we're rolling out interoperability standards, ontologies, etc., around how we use data within ecosystems. But before we do that, I want to touch on something that's quite poignant, I guess, for me. So the King's Fund is effectively, I guess, a think tank, for want of a better word, that is focused on improving health, ideas, innovations around the future of the NHS, around the integration of services between health and social care. And earlier this month, last month now, there was an integration summit at the King's Fund, and that happens every year, and it's very well attended. Simon Stevens, Chief Executive of NHS England, was there, various other people, and the subject for the session for the day, the workshop, the event, the summit, was integrating health and social care. And BT were prime sponsor of that event, so we got a bit of a ringside seat and the opportunity to talk to people who were presenting, and we saw Simon Stevens there, we saw the chair of ADAS, we saw the Chief Officer for Health and Social Care, Devolution from Manchester. That's quite a title, isn't it? But I think it's reflective of very much the way sort of society is going. And it was a really fascinating session, and on my way back home up to Yorkshire, I sort of really reflected on the day. Lots of presentations, lots of good words. But it was actually an interjection from the floor, really, that was the most powerful for me. So we had somebody standing up there talking about integration of health and social care. It was all a bit dry and all of the rest of it. And they finished, and there was a question from the floor, and that question came from a doctor, from a paediatric doctor in London. And it was sort of a bit of a heartfelt plea, really. For me, it was sort of quite profound. And she started off by saying, I feel quite impotent, actually. I do the best I can for my patients every single day of the week. They've got some huge challenges. But the things that will make the biggest difference to those patients' lives, I've not got really any control over. But I see the outcome. I see the consequences of poor housing. I see the consequences of poor levels of education. I see the consequences of these things. Yet, you know, I'm just sort of sat here dealing with the consequences. And that was really very interesting, I thought. And it was especially interesting when the next speaker spoke. So it's a guy called Ian Williamson, who had the long job title in Manchester. And he was responsible for health and social care integration in Manchester. And he made a number of really very, very interesting points, I think. So it wasn't sort of grounded in, you know, the ins and outs and the process and the change and the culture. What he spoke about was really some of their guiding principles. And what they're doing in Manchester is spending an awful lot of time looking at the wider determinants of why people enter the health and social care system. They're looking at the wider determinants of why people, or Manchester has very low productivity rates. And that for me was rather fascinating. And yeah, to do that sort of work, you've got to understand causality, you've got to understand information, you've got to understand data. So we can see the way things are going there. And this next slide really sort of builds on that point, I guess. So here we might have a future city. It looks pretty much as it does today, but it's littered with sensors. And cities are, you know, full of sensors at this point in time, but there are sensors there monitoring traffic flow, management of utilities, refuse collection, logistics operations, education, blue light services, lighting, air quality sensors, all the rest of it. Well, that's kind of interesting, isn't it, I guess? But the more interesting thing is when you actually start to bring data together from different paradigms. Air quality is a particular favourite subject of mine. I drive a Passat with a 2-litre engine. It's a diesel. It's not what was advertised. It's unfortunate. But air quality is a big thing, isn't it? And again, you've seen this in the news with respect to sort of EU levies. We need to understand air pollution in the context of what that means with respect to COPD, other long-term conditions. We need to understand the impact that that has on the health service. But we need to bring those two things together such that we can actually make the right business cases around shaping our cities, that we've got enough intelligence to say, well, actually, if we make an impact with respect to air quality, it might be the council that's putting in traffic calming measures, it might be the transport agency that's thinking about different models of public transport, but actually the beneficiary of that may well be the health service. Well, actually the beneficiary is going to be people themselves, especially with people with chronic conditions. So we think it's really vital when we're talking about local government data, business data, health data, that we can actually start to use it to make linkages, that we can use it to drive intelligence so that we can think about new insights. Slight technical hitch. Some of this slide has disappeared as well, which is unfortunate. When I was a Chief Information Officer in local government, and before I was here in Norfolk, I was in Sunderland, it sort of really dawned on me that if we maintained the status quo, it was going to be massively challenging to continue to deliver services, and that we needed to think about doing things very differently. And I think in Milton Keynes and Bradford, we're starting on that journey. Now, if this slide had materialised successfully, what it would show is effectively a number of different sensor models: car parking, air quality, sensors in the home, bringing that data back to a single focal point. So we do a lot of work with a number of cities, and we've recently done some work with Leeds to look at their digital strategy. And Leeds' digital strategy is built on the concept of a city platform. That's built in part around an integrated care record, the Leeds Care Record. Check it out, it's very interesting. It's built on open source technology. You can go online and have a look at this thing. But what they want to do is to use assistive technologies much more in the home to allow people to manage their own conditions. And what they're saying to us is effectively that this market, which they predict is worth £13.7 billion by 2020, this market is actually going to fail at this point in time. Because what you've got is effectively a lot of different entrepreneurs out there, business startups, the bigger players, the boopers of this world, and they're all creating their own solutions. And it's fragmented. They're all using different standards at this point in time. They're all creating their own data stores, and they've all got problems with respect to linking back to care records, whether they're integrated or not, or whether, like in most parts of the country, you've got one system looking after mental health, you've got another electronic patient record in the hospital, you've got something called EMIS or TPP in GP surgeries. What we've got is an incredibly fragmented system at this point in time. So their thinking is, well, actually, we need to think about a mechanism by which we can bring this together. Now, Leeds are a bit of a beacon with this sort of stuff. They are home to the Health and Social Care Information Centre, as an example. That's based up in Leeds. That looks at information policy right across the NHS. So they've already got a bit of a head start with some of this stuff. And we're actually working with Leeds and Milton Keynes on a bid that we've just been shortlisted for, which is very exciting. It's an opportunity that's been put out there by Innovate UK. It's a £10 million plus match, so BT would be contributing to that along with a set of other partners. It's a £10 million opportunity to create an IoT demonstrator, city demonstrator, Internet of Things demonstrator. Our rationale is that to make this marketplace work, to be able to think about the delivery of digital services, the ability to use information to better risk stratify, to understand people's health and where there might need to be interventions, we need to address this problem of platforms in cities. We need to produce a mechanism by which people can build businesses, cities can build infrastructure, and effectively interoperate together. So that data from cities, in this instance, linking back to the challenges that we've got within the public sector, can be made meaningful and exposed to different practitioners. So in Bradford, I think we've got this slide working. We're working with the council there. We're working with the university, Technology University. I was talking to the Vice Chancellor the other day. He sees himself in the same place as MIT and the other great technology universities across the world. Some way to go to get there, I think. But you've got to aim high, haven't you, with these things? You've got to be aspirational, and he did a very good job in York, where he was there and grew the university by X, Y, and Z, and became part of the Russell Group and all that sort of stuff. So it's fascinating to get an insight about that. So we're working with those guys. We're working with the council. We're working with health partners. And Ruth, you'd probably be advised to check them out, because what they're doing a good job of is starting to build the engagement capability. How do you work with different community groups? How do you work with different sets of stakeholders to take real life challenges, problems and issues into an environment where that can be exposed to academics, can be exposed to entrepreneurs, business people. And the aspiration through linking that to the enterprise zone is that actually we can create new models of connected care going further forward, so that we can push those into people's homes. And as part of the Innovate bid, that we're running, and this is where we start to see the sort of concept of platforms really emerging, I think. Part of the Innovate bid, we're working with Samsung. So Samsung are pretty much as big as they can get, and they've got this aspiration to push something called a home hub. Okay, so effectively a device that manages all of your IoT information and data within the home. You can connect different devices to it, you can control your heating, your lighting, etc., etc. So that's interesting, I guess. But what we've done through that process is introduce giant Samsung over here to a couple of entrepreneurs in Leeds. And what they've established is effectively those entrepreneurs can use Samsung technology to propagate their own business ideas and models. And that's really interesting and fascinating for me. Now, all of that activity, all of, burgeoning digital home market, et cetera, is going to generate huge quantities of information and data, and therefore there's a challenge with respect to what we do there. There's also, I think, quite a significant challenge with respect to how we operate, how public services are delivered going further forwards. We have to ask ourselves, is there the innovation within the public sector to start to think about addressing some of those challenges? And is there the opportunity to expose information and data in the right way to SMEs, to entrepreneurs, to allow them to think about new business models? And we would like to think that that indeed was the case. So this graphic here, it's a bit busy, is reflective of what we're doing in Milton Keynes. We've been part of the MK Smart initiative now for 3 years, and we've rolled out Wi-Fi networks across the city. We've rolled out different sensor networks. There are sensors in wheelie bins in Milton Keynes. Quite exciting. It's a bit passé now. You come along to one of these events and you have sensors in wheelie bins. People go, sensors in wheelie bins. But now it's a bit, so what? Sensors in streetlights. Sensors in HGVs, in public service vehicles. And they're all creating information and data. And that data has been put to some very good uses now within Milton Keynes. So they're controlling the lighting within the city using those sensor networks. They're controlling traffic routes. Hauliers are using that data to save on fuel bills. Big savings involved here by simply understanding the driving patterns of drivers of these things. And that can make a big difference when you're operating very fine margins within your business. Smart parking, we'll come on to that in a minute. Parking, people go, so what? You understand who's in what driving space, parking space, et cetera, et cetera. But actually, they've had some remarkable success with that. So here we are, a bit more about the smart haulage, using information data from multiple different sources in relation to the roadworthiness of the vehicle, fault reports, accessing fuel consumption records, understanding traffic patterns within the city. That's all being brought together, it's all being linked. And we're doing that through the development of an information platform. We call it the Information Hub, and we can see it's here, down at the bottom, and we're looking at how we manage data securely within that environment, how we route that information modeling, very important, the data models that start to underpin what we do, how we link information and data, orchestrating that data and that flow of data. And then the really interesting bit for me, that I've not seen really anywhere else, is creating a developer environment on top of that. So the funding that was used to set up MK Smart and the business case that was effectively created stipulated a single really overriding objective with respect to that information hub and platform. And that objective was that it was used by SMEs. Now we're up to 20 at this point in time, aspirations to move to 90, but this is an incredibly difficult thing to do and to broker. To have enough information and data to actually be meaningful, to have the probity in relation to that data so that people can start to appropriate that into their new business models. And that's quite a challenge, and that's something we're very proud of. BT does a lot of work in this area, and we've been part of a working group that over the last few years has developed a standard, BSI standard. That's called Hypercat, which means we get to stick ridiculous logos all over our slides. But that standard is all about the interoperability of information and data. We'll come on to that in a little while. But if you're going to start to think about exposing data, making it meaningful, there are a lot of challenges with respect to that. If you want to start to link that data, you've got to describe it in certain ways. It's got to be machine readable. And we're starting to do that, which is fantastic. So what have we got here? Smart street lighting. Very similar model, sensors, solar-powered sensors in the lighting, different events, changes in light conditions, etc., etc. And effectively that then allows us to manage the data such that we can actually start to alter the lighting patterns. And that, again, has driven quite significant savings. Parking, we'll come on to parking in a bit. So Milton Keynes, not a lot of people know this, is the fastest growing city in the UK. How exciting. Something we should be very proud of, I guess. However, it's also slightly embarrassing, and it's embarrassing for this reason. Milton Keynes was built on a grid structure, and if it keeps growing the way it's growing, they're going to have some really, really very unpleasant traffic problems. And having crawled through Norwich tonight, I know what they could look like, but probably even worse than that. So big traffic problems, big issues. They've got to think about transport networks. They've got to think about parking, and they've got to think about monitoring those things. And here we are, infrastructure, cameras, sensors, data collection within Milton Keynes, the assessment of pedestrian versus traffic analysis. It was interesting coming down the road into UEA tonight. A taxi driver was there. He was using some rather colourful language, and the reason he was using that was because we're on a road. There was a single lane road, and there was a cycle lane in each direction, and he didn't know what was going on. There were cyclists everywhere, and there was other people coming in. Well, anyway, it was all fine. Everyone was safe. But using that sort of information that's being collected here may well help the council think about how they structure traffic calming measures. And what we've got in Milton Keynes is sensors in car parking spaces. We've also got cameras. And I'm sure we talked about trust and consent and security at the last lecture that took place last week. We won't get too much into that because that's a potentially can of worms. So we've got a car park here, much like any other car park in Milton Keynes, and we've got some clever technology assessing when car parking spaces are full. And we can see there the green rectangle indicating a successful vehicle detection. How exciting. That's great. There's another car coming in there. It's a red one. So what is exciting, I guess, is that before we started this project, the Milton Keynes infrastructure strategy was predicting that they'd need to build more car parks. Well, actually, by using this data, they decided they could put that off for a significant period of time. Better management of this stuff, apps to advise people when car parking spaces are full. And effectively what they're saying is they can delay £100 million worth of investment for a significant period of time. Now, in the current environment, for the reasons that we've described, that's quite significant, isn't it? And I think one of the big challenges with big data, for all of the issues that I'm sure you're aware of, it's very difficult to drive meaningful insight out of data, to get people to act on it, which makes this sort of example really important, because it starts to show what you can do if you assess conditions, if you understand usage patterns, if you understand traffic flow. Well, actually, it can have a material impact on how you plan your city. And that's really quite fascinating. So this is, I guess, our favourite example of where we've been successful in Milton Keynes. A couple of weeks ago, I had a very exciting meeting with some people from EE. Now, if we're talking about the Internet of Things, we're talking about information and data. EE have 30 million customers. That's phenomenal, isn't it? Those smartphones are generating information and data. And a lot of that can be polled and used, which again creates some ethical issues, but I'm sure we use it in the most appropriate manner. So there's a whole raft of information and data that can be used in new and exciting ways. Right. We do appear to be having a bit of a technical hitch, but never mind. I'll talk through it. I'll use the university's machine next time. So assisted living is something that we think is potentially huge going further forwards. Going back to the Manchester example, Manchester have made a commitment as part of their devolution deal that they'll take 20% of the people who are in acute care settings out of those settings into a community environment. Now that's a phenomenal commitment, isn't it? That's quite scary in many ways, and the fact that standing up and saying this stuff is quite radical. So they're going to need to use technology in very different ways. They're going to need to use data in very different ways. And we think there's a big market. We think there's a big opportunity around assistive solutions. So back to the Innovate bid that we're working on, we'll be putting the technology that I described into 1,200 social properties. 300 home gateways into Leeds, 300 into Bradford, 300 into Cambridge, 300 into Milton Keynes if we're successful and we get the funding there. And what we're looking to do really is to test new models of care, of integrating digital solutions with community-based integrated care teams, and to start to look at things like smoke detectors and networking those, taking data from them, carbon dioxide detectors, window, door activation, a whole raft of different sensors, a whole raft of different business models, telehealth, telecare products. BT supports thousands of people with telecare products. If you are in Cornwall, 90% of GPs are actually prescribed a telehealth solution. Big prevalence of COPD down there, which is really sort of kind of fascinating, I think, and gives us a bit of sort of insight really into the way things are going. So a real opportunity to kick this agenda on, and certainly I think a real opportunity, given maybe the aspirations there, to link this research centre with some of that activity, especially if it's happening just down the road in Cambridge. So what we're really saying is that the really interesting stuff here, the really sort of fascinating element of what we think this new world will mean is effectively bringing different domains together, bringing the connected home environment up to such a point that it connects through to connected government, that it connects through to an integrated care record. And this is some of the big stuff that we think needs to happen to really sort of facilitate the creation of city digital ecosystems, to make this stuff meaningful, to lower some of the barriers to access this market. So we think we're operating against all of those criteria. Right, who has a real interest in data? Yeah, no one really. Okay, so you do over there. We think this stuff is really, really important, and we think there's huge challenges in relation to enabling and unlocking some of the barriers that are there today in sort of city ecosystems, to make this stuff real, to make it more tangible. So we've been part of a consortium now for, as I said, 2 or 3 years, developing this standard, this HyperCat standard. And effectively, for the real techies amongst you, HyperCat is an open, lightweight, JSON-based hypermedia catalog. Sounds incredibly grand, doesn't it, I guess? What it means is effectively we're developing an ontology, and that ontology allows us to describe information and data. And it allows devices to say, this is the sort of data I'm collecting, and this is how I'm collecting it. This is how I can share it. This is how you can integrate and link to it. So this is really sort of fascinating for us, because we think that predominantly today data is very much based in silos, and that by adopting this standard, this machine-readable data catalog, that we can automate discovery and access to information and data. And clearly we're talking about more of the sort of physical environment type activity here, rather than anything that might be personal or private. We're breaking down those data silos. We think this is phenomenally important with respect to really harnessing ecosystems with respect to the use of this data. And you can see there that it's at the heart of what we've been doing around lighting and logistics and parking. Project's due to come to an end, but it's been a very successful project. So the Innovate UK opportunity that I talked about is still ongoing. The £10 million IoT demonstrator is mandating the use of the HyperCat standard. So something that's here to stay, we think, and it's going to be widely adopted. And I guess this is another point really for me. If we're looking at these devolved regions, and we're looking at the future of public services and local government, what is the role of local government with respect to setting some of these standards? Do people think about this stuff? You know, I'm not entirely sure they do, really, to be honest. If you sat down with the average chief executive, your average local authority, and started to talk about hypercat, you'd get very short shrift. And that could be dangerous in Norfolk, because the chief exec's office is on the 7th floor, so it's a long way down. But this stuff is really, really important, I think. And if it's used appropriately, and if we can start to publish data, as we are in Milton Keynes, 5,000 individual data sets within that data platform. So linking the research centre through to that will be very interesting in the first instance, I think. But actually making these things available to entrepreneurs and developers is quite an interesting concept. So in Norwich, I know you've got quite a vibrant tech scene. Well, actually, wouldn't it be interesting to start to expose some of that data to those individuals? A few months ago, I got a rare opportunity to go and speak at the Houses of Parliament, at the House of Commons, as part of the All-Parliamentary Working Group on Internet Communications and Technology, and it was still at the point when Mike Bracken, I don't know if people know who Mike Bracken is, but he used to lead the Government Digital Service, and he was still in post, and we sat on a panel and we discussed the concept of government as a platform. And I was there sort of representing, I guess, a local government view. Now, government as a platform, open standards, interoperability is all very well from a central government perspective, but central government is not as complicated as city ecosystems. And what I was arguing was actually that an approach around cities, a city platform, would be more interesting. And I challenged Mike. He employed 600 developers, all the rest of it. It was great news. He's in London. You know, there were some jokes made about being able to recruit the right staff in Norfolk. Clearly that's changing. It's a big thing, or was a big thing, the government digital service. Well, wouldn't it be an interesting concept to build a city digital service? Not through directly employed individuals, but through using entrepreneurs within the city. Now, some of the sort of newly devolved regions, Manchester, Leeds, if it gets its Devo agreement, really see this as a phenomenal opportunity to get involved in this sort of activity, to build almost an ecosystem for the city, but also to build an opportunity to think about developing their GVA with respect to growing businesses within that city. That's an interesting concept, isn't it? And like I said before, a lot of folk are thinking along those lines. From a BT perspective, we think that's interesting as well. We think it's interesting because we have millions of customers in the UK. We think it's interesting because we have national networks. We have a point of presence in a lot of people's homes. We'll soon have a point of presence in your pocket. It's scary stuff in many ways, but that's part of the debate, isn't it? If we're looking at austerity, if we're looking at a 1.5 trillion deficit, which is growing, obviously the rate of that growth is reducing, but actually, what does that mean for us? If we want an NHS that's free at the point of contact, what's the deal as part of that? What does that mean in terms of sharing your data, all right, within appropriate confines with respect to researchers and analysts? Some phenomenally interesting questions in amongst all of this, but through the use of hypercat and other standards, we think we can actually harness innovation. And it's interesting from a BT perspective, because our commercial model is not like many other commercial models. If we have more content flowing over our networks, then that's good news for us. If we can be thinking about the provision of marketplaces that harnesses sort of that activity, and that we effectively have some sort of role in terms of the building of those, this is really fascinating. Now, I'm not saying any of this is going to come to be, but this is sort of part of our thought process with respect to what this new environment might mean. So, really fascinating stuff, and obviously, part of our research interest is in things like hypercat and how we can bring this stuff to bear. A bit more about hypercat there for the really, really interested ones amongst you. I don't think we need to go into that too much. one for the ontology fans. But yes, is it the ecosystem enabler that we need? So back to really what we're looking to do. We've got Hypercat there. We've got information data feeds coming into what we're doing in Milton Keynes. It's the same with regards to what we're doing up in Bradford. We're taking that information and data, we're onboarding it into our information platforms. We're then creating the applications, the analytics built on top of that data. We're providing people with a developer environment. We're looking at service management importantly as well, and that's something else that we think is missing from a lot of this sort of activity. Yeah, we speak to a number of city councils around the UK that are talking about assistive technologies, that are talking about their appropriation. Now, this is really difficult, to get people to use these things, to get value from them. And ultimately, some of these new services may be helping people stay independent. These may be really vitally important services. We have a medical risk team in BT that effectively takes things through the right accreditation process. So, the service management wrap in relation to these new models is very important as well. If you're using a digital service, a digital technology that's generating data that's being used by medical professionals in charge of your care, then there needs to be the right governance in place around managing those services. Now, we're creating ecosystems, application ecosystems based on open standards, open data formats. We want to connect what we're doing in Milton Keynes to other information hubs. We think there'll be a hub of hubs world, all built on open interoperable standards. So this is something that we're committed to for the long term, and we're very hopeful that we can progress with the funding opportunities that are there in front of us. And this is what we might ultimately see the end game is looking like. So for us, there's a health and social care ecosystem that's under a lot of pressure. We need to think about how we use data and information within that. We need to think about the right role-based access controls. We need to think about how data is used and appropriated, how trust and consent is managed. But ultimately, what we think is really going to catalyse this new environment is the ability to link new care settings to old care settings, the connected home to the connected care record. And what we also want to do as part of that is to connect entrepreneurs and innovators in the right way and academics to that environment so we can actually start to jointly work together on some of the challenges that are going to delay or prevent sustainable public services being delivered. So I guess the sort of final message for me around all of this stuff is that if we think big data, big local government data, local data is going to have legs, we need to put in place the foundations by which we can actually do something with it. And having these debates and having some of these conversations will remain massively challenging unless we think about some of the things that are really going to catalyse these environments. And we're very proud of our award for catalysing city ecosystems, but we want to take that much further, and we want to grow something that is going to be of real value to the UK. So, on that note, I'd like to thank you for your time. I hope you found that mildly interesting and useful, and I'm sure now we've got some time for some questions.
Thank you very much. I think a great deal of food for thought was obviously changing very rapidly, and we need to exploit it, derive the benefits from it. Anyway, we do have time for some discussion now. We've got roving microphones, so please do use them. Questions? Yes.
I think I found a lot of what you said very challenging, and I think the underlying thing I've got is contradictions. And I'll start with sort of a bit of a hobby horse of mine. In terms of Norfolk and Norwich, the first thing that the coalition government did was to reverse the decision for unitary status for Norwich, and yet you've said the government recognises that development and sustainability will come through cities, and yet Norwich has no mechanism for determining its own agenda, which is a real problem because it doesn't sit well in Norfolk at all. But I suppose the other contradiction is around people. I mean, I feel we're on a hiding to nothing by investing so much money in looking for data solutions when actually we need proper political solutions. We need to understand the society that we're living in. We need to understand people. And we can generate more and more data. I have a question about, whether we're ever going to use it. It's like this sort of, all my Facebook, it's unmanageable, actually. So I don't worry what the government will make of it, because actually it's unmanageable. But none of it was talking about qualitative solutions. I mean, assisted living, it's all very well and good, but actually what kills people is loneliness and being miserable. Loneliness is one of the biggest killers. Like I go into the supermarket, I don't want to use the automatic checkout. I actually like talking to a person. In the library, I like talking to a person, and yet we're cutting, because all of these solutions are about replacing people with machines, and that's really problematic for our society. So I suppose, if we know stuff on well-being, and we do know stuff on well-being, why aren't we actually applying it? Why aren't we looking for the qualitative? Why aren't we actually sort of looking at the role of people? And stop this nonsense about sort of, encouraging business. We're talking about very few people, and yet we've got huge numbers of people who are unemployed, underemployed, underutilised, and fairly miserable, and yet we still sort of think the role is for a few entrepreneurs to solve all our problems, and it just doesn't at all. Maybe we need to do more sociology. We actually need to understand people, and then we need to change behaviours. It comes down to these choices, these contradictions, which at the bottom line is we want to pay less taxes, but we want a Scandinavian health service and social care service. And actually we can't have both, and the only way we're going to reconcile that is not by collecting more data on people, it's actually by having a proper conversation and by educating people and understanding behaviour. And that's not what I got from this at all. It was just like collecting more and more and more, and I don't know what we're going to do with it.
So there's loads of brilliant points in amongst all of that, and I have to say I agree with all of them. I'm the bloke from BT in a suit, and if we thought we had the answer to society's ills, we'd try and probably flog it. But in all seriousness, this is only a small part of any solution. The loneliness stuff is a really good point, and there has been a lot of studies done in this area, hasn't there, with respect to actually the cost of that within the health service. And I guess in Norfolk, Norfolk is what, 2,000 square miles, if memory serves? That's a phenomenally big area, isn't it? And you've got a lot of rural deprivation and social isolation within Norfolk, which is compounded by the fact that you've got such huge spaces involved. And that's a really, really very serious issue, isn't it? And I think if people are lonely and they're isolated, then there's a lot of studies again that show that your health deteriorates on a rather rapid basis with some of this stuff. So the ability to think about getting visits to people is all very, very, very important. But even in that regard, in other areas of the country, I think in Suffolk even, we've done some trials again with technology. But what we've done is facilitated a mechanism for elderly people to Skype each other. It's really very simple stuff. We had to bump up, it was a couple of years ago now, we had to bump up the package that people were on, because literally people would have it on all day. But it's because they wanted to talk to each other, and that's right at the heart of all of us, isn't it, I think. So this isn't some sort of evil utopian answer to everything. Clearly it's not. And when BT are looking at how we partner and how we work together with people, this sort of capability will only ever be a very small part of the answer, and it will only ever be a success where there's the right integrated working, where there's the right interface into people within the community, and this is part of a solution, a much wider solution. So, I agree with that point. With regard to unitary status for Norwich, I do want to get out of the county alive. That's a bit of a hot potato, isn't it? And it's a bit of a challenge. If you talk to folk up in Durham who've been through local government reorganisation, they're livid because they're part of the Durham County Council area, and again, they feel have even less of a voice, I guess, than the people of Norfolk, of Norwich. Sorry. So that is a really big challenge. I think The Manchester stuff is fascinating in this regard because effectively you've got 10 local authorities in Greater Manchester, you've got 2.7 million people, you've got 38 delivery organisations, you've got a number of CCGs, hospitals. But what they've been really, really adept at is creating the right governance environment to actually make this stuff stick. So you'll be aware of the comprehensive spending review that's going on at this point in time, and the outcome of that will be announced later this month, I think. But Greater Manchester submitted one submission. So it can be done, this stuff, where people have got the shared ambition, shared vision. And I think, you know, again, without wishing to get too political, you know, a lot of the inertia in relation to sort of people stepping forward and talking about devolution has been their acceptance of the concept of an elected mayor. Now, that obviously challenges the whole sort of local government ethos and environment to a certain extent, unless you do the work in relation to underpinning governance. But irrespective of all of that, and irrespective of the actual care that somebody needs, there needs to be a mechanism by which commissioners and leaders within those areas can take informed decisions. And data may well play a role in some of that. So hopefully that's sort of responding to a number of your points, but you know, I agree with all of them.
Thank you very much. I think it's a brilliant vision in which you actually have of how you're envisaging using sensors to essentially increase the efficiency of running cities, even if I do think it's a pain in the arse trying to get onto a bus paying with cash and they won't let me. But what is the actual cost implementation of this? Because I can see a very high investment cost initially, and especially when funds are being cut anyway, where's this money going to come from? And then what is actually going to be the payback time for such efficiency gains within a city, as well as the actual running costs, because I work with big data and I know how hard it is to actually analyze big data. You need to create the algorithms, the programs, which are then processing that data. But to begin with, you need to employ humans. So if you could address any of them questions, that'd be wonderful.
Yeah, I mean, maybe you've got some of the answers actually, given what you do. Maybe we could have a chat afterwards. So yeah, look, it is really, really difficult creating the business cases for some of this stuff. But I think, you know, people see the value of it. You know, Innovate UK sees the value of it. Biz sees the value of it. HEFKI sees the value of this stuff. You know, we wouldn't be here today unless sort of government realised the potential that's on offer. And I think you're exactly right. You know, I've been around the sort of open data agenda for many years, and I sat on the sort of local open data panel with Professor Nigel Shadbolt. I think subsequently been knighted, not because of that, I would imagine. But you know, we were talking about open data years and years ago, and I think it's still not delivered. There's potentially more opportunity now with big data, and I think again it's back to the point around, you know, how many chief executives get this whole agenda? How do we articulate the benefits that are there to be seen? If you take the ticketing example that you've given there, you know, the fact that we don't have a single settlement mechanism in the UK from a transport perspective is pretty poor, isn't it? Really, we have standards, interoperability standards. We have the ITSO standard in relation to smart ticketing, but again, we can't make the business case to effectively roll that out on a national basis. So it is very, very challenging. The sort of the payback that we've got there in Milton Keynes is a really good example. It's a £14 million programme of work. There are copious amounts of benefits involved with that stuff. But when we go forwards, if we're lucky enough to get the Innovate funding that I talked about, you know, the benefits realisation piece, the analysis piece is really, really important with respect to that. Talking about assistive technologies, you know, there is a clear business case for keeping people out of you know, hospital, basically, and that improves their lives as well. So, you know, to take that data and to risk stratify, it's going to be something of a slow burn with this stuff. But I also think there's real opportunity to learn from other places. India, Singapore, Dubai, where there is more investment and there is more opportunity. So it is a good challenge. And I guess you're potentially going to be starting out or have started out in a career in this field. Therefore, you must think there's longevity in it. I think that is the case. So We think there's opportunity here, and BT wouldn't be investing in places like Milton Keynes and Bradford if we didn't think that was the case. But you're absolutely right; it is going to be a challenge. So I'm not giving you really any concrete answers there, but then it wasn't really a concrete question, I don't think.
Hi. There is a lot of social fear with big data due to loss of privacy. And if it's not truly embraced because of that fear, then it skews the result and, loses the objective. So what has been done or thought about anonymization of data so that it can, people can embrace it better?
Well, that's a huge challenge, isn't it? And the sort of Milton Keynes examples that I've given there, people are much happier with data being pulled from wheelie bins, even though I guess it might reflect some of your recycling habits. You've got to be careful with this stuff. Than they are in relation to data that pertains to their own health and well-being. That said, there are initiatives and care.data and other initiatives have come unstuck through their inability really to articulate the rationale for sharing of information and data. So the concept of trust and consent is right at the heart of this agenda. And the only way of really sort of materially addressing this is by proper communication and proper engagement. And back to sort of Lee's example and Lee's care record, 106 of 107 GPs across the city are now using that care record. And that means that people's data are shared amongst care settings. So effectively you're still sharing that data with the NHS. But previously, those different organisations within that construct were using different systems. They've now got an integrated care record. So effectively, people, who use those GP surgeries have been communicated to, and there's been the opt-out and all the rest of it. So it's about defining the reason that you want to do this stuff. It's about being clear on why you want to do it. And there are a lot of safeguards in place with respect to this stuff. And back to the Health and Social Care Information Centre, they do a lot of work with information and data and standards, and they do actually do a lot of work around pseudonymisation and anonymisation of data to provide information to healthcare commissioners. But if you think about it, it's really vital stuff that we understand the health of the populace and we can effectively build the health service to really underpin those needs going further forward. So this one's going to rumble for some considerable period of time. But I think it'll come more to the fore as we see the ever-increasing effects of austerity, actually.
Hello. I'm a user of health and social care, and I am very doubtful about giving my information because it is misunderstood as to what that information means once it's been written down. So that's my first thing about why a lot of people won't be giving data. The other thing is that I haven't got an allegiance with county or city or business or any axe to grind. What we need is for people to listen and respond to what we need at the time. Now, I don't know if you're aware of the Harwood Care and Support Charter in Norfolk County Council. They're trying to develop it in all the contracts with health and social care. And it is an ideal way to get people to say what they need, work out whether you've actually met that need, and then work out the final things that are still outstanding. Now, if you come from the base of what people actually are telling you and the bottom line, then you can see what you need to collect the data on, and it's a much smaller job. And also it will be much more welcomed by the people in that area, and it won't look like a waste of money.
No, I couldn't agree more. I think you know, unfortunately there's a litany of examples of where these sorts of projects have failed to deliver, and they've failed to deliver because what they've delivered has not been of any use to anybody. And I think where we do see success is where there is engagement at the outset. So talking about the Bradford example, you know, effectively there's a mechanism there, a process, but it needs to be fed by input from people, from community groups, from real life. And if we don't do that, and if we don't take people on that journey from the very outset, and if they don't see something that's meaningful to them, then actually the thing won't succeed. So they do a wonderful activity in Leeds, or set of activities, where they're really good at engaging with different folks. And they have something called an age camp, and there's lots of interaction between effectively the city council and people. And that's exactly where it needs to start, even though the city council are a very sort of, you know, some might argue forward-thinking view with relation to technology. None of it takes place unless they've done the engagement, the consultation in the first instance. And I think that's a really vital part of learning. So you've got to do something that people want ultimately. So yes, I couldn't agree more, and it's a really valid point, and you know, that will certainly help you hone down on what's important and what's meaningful, and get rid of some of the sort of spurious mountains of data that potentially is meaningless.
Well, I think it's been a fascinating talk, fascinating discussion. There was refreshments outside, so we can continue talking over those. Just before I finally thank Tom very, very much and let him go for his refreshments, I would just like to say that next week we have another lecture in this series. It's on the Thursday rather than Wednesday, and it's in the Queen's Building. And we have Giuseppe Abamonte from the European Commission talking about regulating big data, the view from Brussels. So I hope to see as many of you there as possible. But for now then, I'd just like to thank Tom very much for a fascinating talk and lots of food for